So
now
you
we
are
can hear
audible
you.
now.
Now we can
I
hear
understand.
you.
Yes. Okay, so a very good evening to all the enthusiastic learners who have gathered here on a busy Monday evening for the first in the series of seminars on research and publication related topics. This is an initiative from the Research Committee, IPS West Zone, and it's my pleasure to welcome all of you here. Let me invite the chairperson, Dr. Suyog Jaiswal, chairperson IPS West Zone Research Committee, to introduce the theme for these series of lectures and welcome the president. Sir, you have the floor.
Thank you. First of all,
Suyog, your voice is breaking.
So perhaps maybe you remove the video feed, then
Yeah,
the voice
video
will be
बंद
clear.
करके देखना.
Okay. Am I audible now?
Yes.
I welcome you all on behalf of IPS West Zone subcommittee of the series.
No, Suyog, your voice is still breaking.
I think his microphone is weak. His network is good.
Am I audible now, sir?
Yeah.
Yes.
Yeah, better.
Yeah. So, on behalf of IPS West Zone, all of the series that is going to be talking about how research is taken ahead, how to read research, how to conduct research, and we decided to start with something that is very apt for people who have busy clinical practice. It becomes quite difficult for busy clinicians to write a research article. However, the clinical practice gives them vast expertise in various clinical anecdotes, and these anecdotes at times are, when communicated to others, they can also learn. We are aware that many often we share it in our clinical meetings, many often we share it on our WhatsApp groups. When we meet our colleagues, we discuss about those. However, there is a scientific way to put it, and we decided who else can be better than telling us how to do it than our editor himself. So that's how we started this program today. And I welcome Madam for her patronage and
Okay, am I supposed to speak? I missed all your last words, Suyog. So
Yes,
really
ma'am.
sorry for that.
Please, ma'am, guide us by your wisdom and please
अरे
give the
दीदी
welcome
ऐसा कुछ
address.
wisdom वगैरह ज्यादा नहीं है. But good evening, everybody, and welcome to the first of the series of lectures by the Research Committee of IPSWZB. An excellent initiative, because till now the Postgraduate Psychiatric Education Committee has been doing all the academic kind of talks, especially related to, research and maybe publications, as well as other academic activities. This is an activity which I think is needed by all, especially those in clinical practice, those in private practice, who often have come up with this like, we don't know how to do research, or we don't know how to put forth our ideas, or we have seen so many cases, or we have case theories, we have seen so many patients, but we don't know how to put it across, especially even in the West Zone Journal, that is Annals of Indian Psychiatry. When I was the editor, that time I used to get a lot of queries from consultants, etc., to help them write on a simple thing like a case report. And I think that is the best way to begin, because if you know how to write case reports and put it across, then you can move on to other research areas like the original articles or systematic reviews, etc. So today we are fortunate to have Dr. Avinash, who's going to be, I'm sure, a wonderful teacher in telling us how like there is learning for each one of us, and I'm sure he's going to put across the care guidelines, etc., so that if you follow them, at least you know that your case report will be accepted, with minor changes here and there. So over to Pooja for conducting, and a warm welcome again to all of you.
Thank you. Thank you so much, ma'am. Let me just share my screen so that I can introduce our chairperson for today's session. Are the slides visible?
Yes.
Yes. So it gives me immense pleasure to welcome our chairperson for today's session, Dr. J.K. Vankar sir. Sir, of course, needs no introduction with his more than 40 years of vast experience mentoring psychiatrists, postgraduate teachers, PhD students, and many more. Sir is Professor Emeritus of Psychiatry from Parel Institute of Medical Sciences. He has formerly been editor of the Journal of IPS West Zone, and sir has also established the G.K. Vankar Best Paper Award to encourage research among PG students of Gujarat. Sir, please, I welcome you to share your thoughts regarding our topic for today and also introduce our speaker, Dr. Avinash D'Souza.
Thank you so much, Dr. Pooja. I welcome all the audience as well as today's speaker. It is my proud privilege to introduce Dr. Avinash D'Souza. Avinash D'Souza does not require an introduction because most of the people all over India know that he is very much academically oriented. He is editor of Annals of Indian Psychiatry currently. He is consultant psychiatrist, very experienced one, founder trustee of D'Souza Foundation, Mumbai, and he has, to his credit, 100 plus research publications and written chapters in psychiatry books. Dr. D'Souza, without further dwelling on the subject, I straightway invite you to present.
Thank you,
Dr.
sir.
D'Souza.
Yeah, thank you, sir. Please share my slides so that I can start. Just put the slides on. Yes. So today we are here primarily to look at certain facets wherein we want to sort of focus on different aspects of how to write a case report and letter to the editor. Now, these are two important areas because not many people do this work, and I think it's a very essential area that people should work on. Next slide. Yeah. So why are we talking about case reports? Because I think case reports are very clinical in nature. They are very specific in nature. They do not take much time. So, they can be written fast. They do not need days and months of preparation. And I always feel that case reports are data that clinicians always have. So we all talk about cases, we present cases, we discuss cases with our colleagues, but we never sort of make the effort to write it out in a journal format. So who can write a case report? I think anybody can write a case report. It's the most easier form of, in fact, even compared to letter to the editor, it's the more easier form of, I think, publication that one could probably work on. So a clinician who's seen a good case could take some help from whoever he or she likes and write a case report. Now, a lot of people ask me that, is my case worthy of a case report? Is it, how do I decide? How do I choose the case? How do I decide? So I always say that there are 3 or 4 questions that you need to ask yourself. So is my case very common or is it rare? That's the first thing. So if you find it's rare, yes, it's definitely worthy. Second question that you need to ask yourself is that, have many cases of mine been published before, similar to mine? And if you go to Google search and you find there are not many cases like the case you've seen that's been published, then all the more it's worthy of a case report. If your case is of a common disorder, but in a very different way, or it presents with a very unique form. So I'll give you a very simple example. So suppose you're seeing a case of delusional parasitosis, which is very commonly seen in practice, but you see it in a blind patient, and there are all sorts of visual hallucinations also involved and other things involved. And you want to think it's a different kind of delusional parasitosis case. Yes, so it's worth reporting. Suppose you see musical hallucinations in a patient with schizophrenia. Again, it's a rare kind of finding. So it's something that is, worth reporting. For example, if you find a rare genetic condition associated with a psychiatric problem, it's worth reporting. So you have to decide on this basis that is my case unique? Also, if I've seen side effects, always remember side effects are also worth reporting. So if you've seen rare side effects, you should report. So, for example, a new drug comes into the market, like say lemborexant, or let's say vortioxetine, and you see that a patient develops nightmares after you give the drug. Not much literature is available on a new drug and its side effects, so report it. If you use it in a patient accidentally gets pregnant, comes to you after 4 months of pregnancy, and the child is born normal, you might be the first person to report that vortioxetine was used in pregnancy successfully, and nothing happened to the mother and the baby. It's a very good case report. It's a very simple case report, but it's a good case report to document that it's safe. Otherwise, if you go online, they'll say safety data is not available. So these are things that you need to keep in mind. So what are the types of case reports that I can come up with? One, case reports which are of rare cases. So it has to be really rare in the sense that a lot of people think Wilson's disease or Tourette's is rare, but there are many case reports already written about these conditions. So it has to be rare, maybe a rare form of epileptic disorder with psychiatric comorbidities, or a rare form of intellectual impairment, genetic condition with some other problems, or a common disorder like major depression, but with a rare condition. So major depression in a case of, say, retinitis pigmentosa, where visual issues come up, or major depression in a case of a rare skin disorder where some issues come up. So those side effect related case reports, so paroxetine induced nightmares for that matter, lemborexant induced daytime sleepiness, which is not reported by lemborexant, but it's something that if you see in a patient, you should, or for that matter, delirium caused by, say, lemborexant or oxazepam or any other drug. So these are important things to report. For example, cariprazine. Now, it's a new drug used in schizophrenia, and if you're using it and you find some side effects that come up, it's definitely worth reporting. Also, in an old drug, like, if you take up a drug like disulfiram, generally people develop psychotic features with it or neuropathy with it. But if you see some rare side effect with it, then you should probably report, and it's something that will be accepted. You can also do what is called a case series. When we say case series, what happens is you have a number of cases, 2 or 3, and you feel they are similar. So let's say you're working in a school and you see 2-3 different types of cases of school refusal, or you see 2-3 different types of cases of bullying, or you see 2-3 different types of cases of exam anxiety. You could probably club them together and report them as a case series. So that is also something that you could do. The case report is very easy to write because generally most journals tell you that it should be around 2,000 words, not more than that, excluding references. Not the worst thing about scientific writing is people say, I don't know how to write references. I don't know how to, in what format to write it. So case reports, the journals have very strict guidelines that you can't have more than 3 or 4 authors. So you can't have 9 or 10 authors and write a case report. So generally, the resident who's seen it in SCIEN, the policy that we follow is the resident who's seen it is the first author, followed by the lecturer who's seen the case. The assistant professor is the second author. If it is shown to a particular senior, that senior is the third author. So that's how the case, the format works. If 2 residents have seen the patient in the ward, then of course, both can be first and second author. So we don't exceed 3 or 4 authors maximum. Many journals have a 4-author limit on case reports. 5 maximum, but 4 or 3. Some journals even have 3. So it depends. You'll have to see journal to journal. The word count varies from 1500 to 2500 words across journals. Reference wise, they also say you can have only 10 references or 15 to maximum 15 references. So it's not so much of an effort to write references for a case report. And it's easily doable because you already have the history. So most of your article is already with you. It's only a little bit of introduction and discussion that you need to add. Next slide, please. Yeah, so the first part of your case report is the introduction. Now, the introduction is a small part of the case report. It's not at all daunting or worrisome. So, I mean, let me take a very simple case like delusional parasitosis that you want to report. Now, why do you want to report this case? That's the first thought that has to come to your mind. We all know what it is. We all have seen patients. There's nothing new about it. So why are you reporting it? So you write a little bit of introduction about the disorder, and you write about what's so unique in your case, and if there are references about it, and you mention why you want to report this case. The introduction is the least important part of your case report. The reviewers are not going to see it so much and worry about it so much. The case history is what they're going to see. So for me, your case history has to be in detail, and it has to be in the narrative. It can't be like you write it on an OPD paper. It has to be in a narrative format that I enjoy reading a story. Like, though I'm reading a story that so-and-so came into this thing, this was a thing. You can add some English words, you can add some scientific words. It has to be in a very nice narrative manner, just like how you would probably present in a conference, in a clinical case conference when you present. So that is something which, if you look at a few case reports that have been published and you see the manner in which they've written their history, you can always keep that case report print out with you and model your history on that. That is something which can be done. So cases of delusional parasitosis that have already been reported, let's say you're reporting vortioxetine-induced nightmares, and you take up a case report of, say, nightmares reported by another drug. And when you do that, you can easily look at how they've reported their history, how they've done the introduction. And you don't copy paste, but you model your case report on that. That is something I advise beginners, and it's very easy to do. So the introduction is probably around 150 words or 200 words, not more than that, 150 rather. The case history is a major chunk. Everything about the case has to come in there. Lab investigations, MRI findings, EEG findings, everything has to come into the case history. If there's a skin condition, then details about it. If there is a skin reaction, details about it. Everything has to come. Don't leave out anything. Positive history, negative history, family history. Your entire case history has to come in, just like how you may probably write it in the patient's file. When you take a detailed history, you write it in a little more scientific manner here. The discussion is the most important part of your case report after the case history, because in the discussion part, you're going to mention why this case is important. In that, you'll mention that many cases have been reported, but what is different over here is 1, 2, 3. Then you'll also mention what treatment you gave and why you chose that treatment. So for example, if normally we use pimozide or we use risperidone for delusional parasitosis, but if you use cariprazine, it's worth reporting that cariprazine caused improvement in delusional parasitosis. So then you have to justify why you chose cariprazine and not risperidone, or why you chose amisulpride and not risperidone, and justify why you found an improvement in this patient. How did you judge that improvement? So a lot of people say we don't have a rating scale. You can even use a scale like CGI, which is a very simple scale for improvement for you to know. If not, you can say on clinical assessment, there was probably a 30%, 50%, 60%, 80% reduction in severity of symptoms as reported by the patient. That also works. So that is a discussion, is the around 200 to 50 words, so totally your case report is around 1500 to 1700, 1800 words, not more than that. The abstract of your case report is very simple. It's around 100 words, not too much width. So that is something which anybody could write. Now, the key thing is, a lot of people tell me, sir, I've written the case report, I've submitted it. I get queries being the editor of Annals that it's been 6 months, 8 months, there's no response, or it's been accepted but not published. I can't publish more than 2 or 3 case reports per issue. So I may have 30 lines with me. It's going to take 10 issues for all of them to get completed. So people have to realize that case report publishing takes a little time. One important case report which I missed out and you can write is also psychotherapeutic case reports, where you can write about psychotherapy sessions and how psychotherapy benefited a particular patient in addition to medical treatment, whatever was given. I remember having reported with the therapist that works with me a case of flying phobia of going by aeroplane, which was a rare case. Now we have no medication for it per se. So we only had clonazepam SOS when he was on the plane. Beyond that, nothing else. But we reported how therapy helped. And the patient today is a businessman. He flies, he travels, he goes everywhere. So session by session, we documented that in around 6 or 8 sessions, how we helped him. And a leading journal wanted that because they said there are hardly any case reports on flying phobia. So we are very happy to publish it. So you have to also choose your journal very wisely. Now, let me tell you, psychiatric case reports, not all psychiatric journals will accept them. So one of the tricks I tell people is look for non-psychiatric case journals. So if you have a case where you have menstrual disturbances, look for a gynec journal. They'll be very keen to publish it because that's something they don't know. It's new to them. They'll be very happy to publish it. If you have somebody who develops tics due to a particular drug, a neuro journal will be very happy to publish it because a neurologist wants to know what is going wrong. If you have somebody who develops a skin side effect of a particular drug, not all psychiatric journals may be open. They may say we don't have space, we don't have, but a dermat journal may be very happy to publish it. So you have to look at journals beyond psychiatry also. There are a lot of medical journals that are there. Let me tell you, there are also specific journals. Like we have journals that only, there's a journal of clinical case reports that only publishes case reports. There is an Indian journal of case reports that publishes only case reports. So you have specific journals that actually only publish case reports. So that's also something which is a very, very nice way to look at when you're looking for the first time where to send your report. You don't have to give it in a paid journal. There are a lot of free journals that will accept it. So don't pay to publish a case report. So you choose your journal wisely. How do I choose? Suppose, let's say, I'll again come back to a very simple example. I'm looking at a very common drug like escitalopram. And let's say a patient of mine with escitalopram develops dyspareunia, pain during sexual intercourse, as a side effect. Now, where do I publish it? One is I go online and search for cases of escitalopram induced dyspareunia. I see how many journals have published it. And the journals which have published it, I don't go there again because they've already published this. They're not going to publish a second case report on this. I look at other journals. What are my journals that I look at? I look at sexual medicine journals. If it's a female patient, I may look at a gynec journal. I may look at a psychiatry journal. And I will look at a journal which is more sexual medicine oriented. They'll be more likely to publish my report. For those of you who are publishing side effects, there is a particular algorithm which most journals ask you to follow and you have to tick. It's known as the Naranjo's algorithm. Naranjo's algorithm is a score which you get for side effects. So there are various questions asked so that you can determine that the particular drug has caused the side effect. So if your score is higher, then your chances of drug causing the side effect is higher. Many journals ask you whether you re-challenge the patient again with the same drug and whether the same side effect came. But sometimes if there's a skin reaction, we say the patient refused to be re-challenged with the same drug. So we couldn't re-challenge. So Naranjo's algorithm is a lot of reviewers who review these papers will tell you, can you apply Naranjo's algorithm to your case? And it's very easily applicable. It's very simple. It's published in 1981 for the first time. It's very, very simple and it can be applied. So there are a lot of pharmacological journals that also publish case reports. So if they are particularly drug related. So that is something which you should look at. Next slide. Like I told you, which journal and why? Yes, because the thing is a journal that has more visibility with regard to what you're publishing. So for example, if let's say I publish an ophthalmology side effect in the Indian Journal of Medical Research, it may not get so much visibility versus if I publish it in the Indian Journal of Ophthalmology. So I have to choose my journal whereby my case report gets visibility. Always remember that searching the journal is very important. Spend a lot of time in searching the journal. A journal which is more likely to accept your case report is very important. Case report publishing takes anywhere between 3 months to a year, so be patient. A lot of people think nahi publish hua hai. It will get published eventually. Peer review, it does go through peer review. Peer review is when 2 people or 1 person will review your case report, come back to you with suggestions. They will ask you a lot of questions. Be honest, don't lie. So if you find you've not done something, say you've not done it. It's okay. You can't do everything. If they say, did you do this test, that test, say we didn't do it. They'll say, why you didn't do an MRI? We can say we wanted to do it. Patient was not cooperative, did not agree. Patient took an early discharge, went to take another opinion. There could be multiple factors. So whatever were the factors, be very honest. If you're using MRI images, see that they are photographed very properly by a good camera. You also have to make sure that the patient name, MRI number, hospital name, etc. is not there. So those are requirements which are there. There are guidelines for this, like Neena madam said. If you're using patient photos, the patient's eyes have to be covered. No identity should be revealed of the patient. If you're using photos that involve photos of the genitals or photos of the breasts or photos of parts which are private parts, you have to only show those parts. Don't show the whole body and don't show. So be very particular how you're going to do that. Similarly, if you're using EEG graphs or you're using polysomnography graphs as a part of your case report, make sure that they are photographed very properly, because journals demand high resolution color photographs. Some journals publish them in color as well. Some publish them in black and white, but they demand high resolution color photographs. So that is something which you should, nowadays with mobile phones, it's very, very possible. So it's not that, but make sure that your MRI images are clicked properly. Next slide. Why do we write a case report? Because it's clinical. It's very important. It's very easy. What does it get you? It gets you name and fame. Tomorrow you may find your name in some journal where they say you are the only guy who has published this case report. So from some of the case reports which I published, they say that the first ever case report was published by D'Souza in 1999, following which other people published number of reports. So you get that kind of fame. I always feel clinicians must read case reports because it adds to their clinical touch and it's important clinically. I remember, I'll give you an example. I published a case of valproate-induced palatal myoclonus. Treatment of palatal myoclonus with valproate. And I had a patient that called me up from Australia saying that she has palatal myoclonus for many years. Nobody in Sydney or Melbourne have been able to treat her. And she saw my case report. And she said that we would like to take your opinion online and whether we should start sodium valproate. And she started and she improved. So, people search online. Similarly, since I have published a number of case reports on trichotillomania, I get a lot of patients who come to me and say, we've actually seen your case report online and want to consult you from all over India. And we want your opinion. And I've got around 8 or 9 cases of flying phobia that have come to me after that case report got published. So, I mean, I'm not saying that, yes, it'll, it may not translate into large volumes of work, but you will get patients who come to you because they think you're an expert because you're published in that area. So it helps you stay in touch academically. It's easy to do. It doesn't take much of your time. So if you have everything in a week, you can easily write a case report if you give 1 hour a day. So it's not that it takes a lot of your time. And it's important clinically because other people will read. Tomorrow, let's say I see a patient with a side effect. What do? I go online. And for example, I see that Suyog has published a case report. And I'll say, Arey, ye to apna Suyog hai, I'll phone him, I'll talk to him, I'll ask him. I mean, it's important. It gives you an idea that, okay, these people, have worked in this area. I'll take his opinion. And we all know many of the psychiatrists all India. So if we see they've published, we may just phone them and tell them, I was seeing your report and can you give me some guidance? I'm also seeing a case like this. What should we do? And you never know, you'll get help clinically. So it's important. Next slide, please. So we move to the second part of my thing, which is letter to the editor. What is a letter to the editor? A letter to the editor is a very small letter, around 700 words. Doesn't take a lot to write. And it's a letter addressed to the editor of a journal about certain issues. So, and this is generally single author, or it may be 2 authors maximum. The journal doesn't allow more than 2 authors for letters, unless it's a group that wants to address some issues. But otherwise, 2 or 3 authors is maximum what they allow. References are very easy, only 2 or 3 references, they don't allow more than that, so you don't have to worry per se. So what are the types of letters that I can write? One is there are different types of letters. I will, of course, come to that. I can write a letter wherein I discuss a certain pertinent issue. I can even write a letter where I discuss a side effect that I'm commonly seeing. I can write a letter where I'm probably discussing a psychosocial issue. So the length is small. It's very easy to write. And you should read letter to the editors in all journals. You'll find that there's so much of clinical relevant stuff in it. It's not that every letter is boring. So the letter is very useful and it gets published easily. Let me tell you something that not many people know is that letter to editors can get published as easily as in 1 month to 2 months if it is pertaining to a current issue. So if in COVID, you brought out a very important aspect of COVID, the letter would have got published immediately. So these are some things which, so for example, let's say, if you're in the current scenario, if you're going to talk about something related to AI and you write a letter to the editor, the letter will get published very fast because AI is upcoming. Or you write about chatbots, or you write about mental health apps, the chances that your letter gets published is very fast. Next slide. So it is a useful addition to your research. So what are the types of letters? One is critical letters. I criticize that, what is happening in clinical settings is not proper. So somebody I know, very senior neurologist who wrote a letter, it got published in the American Journal of in the Journal of Neurology. It's neurology alone is a very important journal. It gets published weekly. It has so many articles that come, and he wrote a letter that we are cultivating a breed of MRI negative neurologists. So, it was a critical letter that the dying art of the neurological examination is lost. No one carries a hammer, no one carries a tuning fork, no one carries anything. We are just doing MRIs, and the MRI guides are neurological findings. So the neurological examination is lost. Similarly, the mental status examination is lost. You could say today's postgraduate students don't want to look into a mental status examination in detail compared to how we used to in the past. The psychodynamic formulation is no longer done. So you could write a critical letter, explaining that. You could write a letter which is based on a psychosocial problem. So issues related to adoption, say financial problems faced by patients with regard to medication. It could be with regard to marriage and psychiatric patients. It could be with regard to 2 people who are having autism spectrum getting married. So there could be multiple factors, You could also have a problem letter. So problem letter meaning, so if you find there's a practical problem, so I published an article, you think what I published is wrong and it's not proper, you discuss the problem. That with reference to this article published by Avinash, we feel these are the faults, 1, 2, 3, 4. And I respond to your letter as an author of that article. So that also gets published very fast because the journals want me to rectify what I've done or not rectify or defend. So that's there. Some case reports can get published in a letter, and there are some things which I call practical problem-based letters, like POXO Act implementation, certain practical problems you can put in. Like I remember we sent in a letter during COVID that we used to miss out cases of tardive dyskinesia and jaw movements because of the mask. And it got accepted because it was a practical problem seen during COVID, that we would tell patients don't remove the mask. And as a result, sometimes we would miss EPR, So these were things which we sort of, put. So those are practical problem kind of letters. Next slide, please. Anybody can write a letter. It doesn't need hardcore scientific knowledge. And you can choose a journal that will be keen to publish your letter. So you decide a journal. Most journals publish letters to the editor. 500 to 800 words is what they allow. So you can decide which journal you want. You can also decide what you want to address. Address a very, very specific issue. So it could be something like how postgraduate students today prefer to study online versus read a textbook. It could be something like that. It could be the fact that a textbook like CTP is no longer referred to. People refer to, online articles, or they refer to notes. I mean, you could write anything you want in a letter, but yes, the journal matters. So for example, if you're writing something like this, send it to a medical education journal. The chances are more likely that they'll publish it. IJP may not publish it so much. Send it to a journal where postgraduate students, Like I remember we sent in a letter to the Journal of ECT because during COVID, science was the only department that did ECT. So we wrote about our experience of how we did it and what we did it, how many cases we did. There was no mortality. It got accepted immediately. In 10 days of submitting it, the acceptance came. They sent us the proofs. They said, we want to publish in the next issue. So these things happen. So you have to be fast to, publish things related to current issues. So for example, let's say there's a NEET exam in May. And in around April, end of May, you write something about related to the NEET, the fact that it causes anxiety. You're seeing cases of anxiety. It'll get published immediately because the time is right. Whereas if you go in October, no one is worried about NEET now. No one will publish. So your time matters. You could also publish congratulatory letters, wherein if you like a particular article, write a letter praising the article. It'll also get accepted. The journal feels nice that they feel, okay, someone is appreciating what we're publishing. And that, I've been reading your journal for the last 10 years, and I've seen that in the last 10 years, every issue has around 5 or 6 articles which are very clinically relevant. The journal is very readable. It's very likable. And I'm a private practitioner, but I enjoy reading your journal. They'll be very happy to publish a letter like that. Even issues with publication, if you feel the journal is publishing nonsense papers which are not relevant clinically, write to them. That, it's a journal of clinical psychiatry, but what you're publishing is not useful clinically. And they'll publish those kind of letters also. So you can talk about that as well. Or peer review is taking a lot of time in journals. You could take that up. How some reviewers don't respond. So those are things which, there are ethical letters also that some ethics were violated. So those are things which you can, and there are journal of medical ethics and other journals which will look at those letters. Next slide. So how do you get help? You can always ask me. I'm always ready to help anyone without asking for authorship. I don't want authorship in your letter or your case reports. So I'm very happy to help you publish if you need help. Ask people who've already published. So ask authors, who've written that I'm trying to publish. Can you help me? Ask academicians or people who are in a full-time professor academician post. They will probably guide you. Ask students, who are writing, write yourself. I always tell all my students, Sayan, write. It doesn't matter. It can be in your tootly-fartly English. It doesn't matter. I said, you write, I will, correct the grammar. I will help you, change. But unless you write, you'll not learn. So I tell them, write the case report, and then I send it back to them. Correct this, correct that, correct that. These are my questions. Answer them. It goes back 4 or 5 times till they, perfect the art. Okay, now the case report is perfect. How do I learn scientific language? I have to read more. The more case reports I read, the more letter to editors I read, the more journals I read, I get that hang of scientific language. So one exercise which I tell students to do, and I tell even people to do, is, suppose I tell you that there is an increase in the prevalence of depression in India in the last 2 decades. Write the same sentence in 5 different ways and show it to me. So you will then learn how to write scientifically, how you can write, in different ways, the same thing. So that your vocabulary, your scientific language increases. And you have to read more. See, reading a letter to the editor takes around 20 minutes, which you can give every day. It's possible even with a busy clinical practice. You can read it before you go to sleep, or you can read it in the morning with your newspaper. You don't have to read a lot. Reading a case report doesn't take more than 30 minutes. You can read a case report every day. It'll improve your knowledge about many things. So those are things which, would definitely work. Next slide. Yes, so if you need any help, you can just email me. You can go to the Annals website, look at the journals. The Annals has a lot of case reports published, a lot of letters published. So you can even use that as your resource. You can go to the IJP website, use that as your resource. Go to the South Zone Journal and look at it and use that as your resource. So there are various ways. And if you need anything, you can always WhatsApp me or email me, and I'll be more than happy to help. And if there are questions, I'll take them up. Thank you.
So the floor is now open for questions. If anyone has any queries or questions for sir.
I think Vankar sir comment I will be waiting.
Okay. Okay, then I would give my comments. Thank you so much, Dr. D'Souza, for your very practical and very succinct advice for the writers of case reports as well as letter to editors. I was also reading similar kind of article in one journal, and the author mentions that the important resources are up-to-date, PubMed, and there is one more, that is cases databases, which has several kinds of cases described, which have been reported in almost all journals. This database caters to that. Important thing we need to also may consider is our abstract, because say if our abstract is good, then and then other audience would read. And I want to emphasize that in discussion, we should always endeavor to give take-home messages. What is important, why you have put this case report in the journal, that you must mention. Say that would help you getting much more audience. I think that when you prepare your manuscript for your article, say case report, consider rule of C's, especially clear, concise, coherent, consent, compassion, and competence. Some journals also consider patient perspective in addition to what we discussed. So right from the inception, that is consultation with a psychiatrist, for example, to the conclusion, say what has been the patient's experience, they also include in case reports. Another important thing is that once you are writing, say probably you should not write any case report dealing with preventive aspects or say therapeutic efficacy wise, because say this would require much more vigorous methodology and larger study. And that is why say these aspects should probably not be included in case reports. Before I conclude my comments, say something regarding the letter to editor. I would also advise all the postgraduates to see our medical fraternity journals. For example, I would cite my own example. I was going through an issue of Indian pediatrics. I saw an article, a case report on panic disorder in adolescent boy. The author had discussed so many things which were out of date. So I wrote a letter to editor. Surprisingly, in the next issue, my letter to editor was published. I was much more surprised when I had invitation from recent advances of pediatrics to contribute an article on panic disorder. So this is how, say, a trivial thing like say letter to editor can lead to earning rich dividends. And that is why everything which we publish in journals is important. I wish to thank IPS Western Zonal Branch, this particular program, as well as the speaker and organizing team. Thank you.
Thank you. Thank you so much, sir, for sharing your experience with us. So we have a few questions in the chat box. One of the questions is from Dr. Nitisha. She says, is it okay if the journal is not indexed but peer reviewed?
I think if you're, a beginner and you're looking to publish for the first time, the journal has to be peer reviewed. And I think even most journals, they have some indexation. It may not be that they are indexed in maybe major indices, but they're definitely there on Google Scholar. Like I run a journal called the Indian Journal of Mental Health, which is on Google Scholar. It is there. We publish the papers on ResearchGate. So it has some indexation. So you will get, publicity. If you type on Google, your article will be seen. So anyone who searches using Google Scholar will see your article. So it's a journal which we developed primarily for beginners, because at Science we had a lot of our residents who said, so we don't know how to write. So we need a journal that will accept our papers. So we said we'll come out with our own journal where we'll be open to, accepting any paper that anyone sends, as long as it falls within the realm of the journal and we find it's relevant. So we give all students a chance there to publish. There are no charges for it. There's nothing. It's solely being run from my pocket money. There's nothing. So we come out with 4 issues a year. So, and the issues are nearly 150 pages each. So that shows how many people send papers. We get papers from NIMHANS. We get papers from PGI that they send us. And I tell them the index it's not indexed in a big way. They say, no, but it's okay. The paper we feel we need publication, and it's okay, because your journal is regular. That is what is important. So, and you have a website, it comes out there. Our articles have a DOI number, which is a specific publication number for each paper. So we have all that in place. So, and our publication guidelines are stringent. We have plagiarism checks, we have everything. So, so they respect that. So we do get papers from that thing. And we're open to all sorts of paper, which other journals may not be. So that also becomes like, I remember I published a paper where we wrote that how do we manage, what are the guidelines when a fellow medical professional comes for psychiatric help? What should you follow, not follow? Because many a times our tendency is we want to help them, but we don't want to damage their career. We don't want things to go wrong. And this is a more private practice issue that is faced. So we said that what should be the guidelines that we follow as a psychiatrist? How do we keep records? What do we do? And the institution wants to know, if you're in a full-time medical college, the institution wants a report on them. So what do you, how do you report? What do you say? So just small things like that. So that's what.
Oh, thank you, sir. The next question is, sir, what are some journals which beginners can start reading as a first or second year psychiatry resident?
So I think look at our own West Zone journal, start reading the Annals of Indian Psychiatry, then you can read Indian Journal of Psychiatry. And then, of course, those 2 journals to start with, I think are very good. And then you can move on to journals which are published abroad.
So with this, I think we are coming close to the end of our session. Are there any other questions that anyone from the audience would like to ask? Suyog sir, you are not audible, sir.
In Science, we make everybody publish. Pakad ke usko publish karate. That is our whole aim. Of course, we don't put pressure on them. It's their free will totally. But it's like they have to leave Science publishing something. And that helps them. Many of them they come back to us and say, sir, I applied for a lecturer post because of the 7-8 publications that I have, that I got in. Otherwise, we never realized that publications are so important. Even case reports. So, I think you should publish. Suyog is mute, but we are understanding your emotions. Don't worry. I'll put this that. It's.
So perhaps you can share your question on the chat box.
Okay, yeah, you could do that. Well, I must say something. I'm presenting on research here with Nina Madam, under whom I did my first 2 research papers of my life. Of course, I never stopped after that, but I did my first 2 papers were with ma'am, which I always thank her for. That is way back in 2002, 2003. How much extra word limit do journals allow for case series over case report? So yes, so case series can extend up to 3,000 words. They do allow some leeway because they know it's going to be bigger. So 2,500 to 3,000 words, depending. If it's a very interesting case series, they'll give you more space also. Case series should have minimum how many cases? 2 to 3. Anything more than 1 is a case series. Can I know if case report discussion is different from a research dissertation? Definitely. A case report discussion is very small, whereas a research dissertation is when you're collecting data and you're doing your thesis from an MD point of view. That's very, very different. In a case report, there's only one case, which you're probably working on.
So, ma'am, I'll invite you for final comments and some concluding remarks, after which we can close the session, I feel.
I think Dr. Vankar has given excellent concluding remarks. And yes, I thank both Dr. Vankar and Avinash for giving such a very lucid session on how to write a case report and a letter to editor. And what he said is very, very, very true, that we have to catch the PGs at that age and instill this art of writing, because then only you will carry it forward. If you've not done anything in your PG days, apart from just writing a dissertation but not publishing it, and not publishing any case report, when in your PG years of 3 years, I'm sure you come across innumerable rare cases, some different adverse reactions, etc., which you should not miss an opportunity to write. Because when you do it, then that the ball sets rolling, and then that is how you will carry it forward, even when you are practicing consultant, etc. So I think that's a very good message, take home message. And the best way to begin is, yes, with a case report, which is very, very simple. So many of our residents always present at conferences. And if you look at the free paper sessions, there are innumerable case reports which are presented. And they have got diagrams, everything is ready. They've got pictures, they've got discussion. The only thing which is needed is translating it in a journal format and sending it to the journal for publication. But so much procrastination is there. Like, I always remember when I was the editor of Annals, every time I would go to all those free paper corners and kind of, mobilize and motivate those residents or speak to the teachers, please send it for publication. So I don't think we should be doing that. It should be coming from them. They have to take responsibility for their own publication. And I'm sure should come. NMC has become a little strict, though they have waived off this publication criteria currently. I'm sure it'll come back a couple of years from now, where it will be mandatory for each of them to have a publication to appear for an exam. So I think it was a very good session, and I really thank Avinash and Dr. Vankar again for their comments. Over to you. You can wind up now.
Thank you, ma'am. Finally, thank you, Avinash sir, for sparing your time and such nuanced information from your experience. And thank you, Vankar sir, for sparing your time and guiding us through this session. With this, I'll close the first session in the series on publication and related topics.